Good morning, Green Scene. This is Cole Comer, your publisher at Salt Lake City. We've got a special guest today. We're sitting down with Richard Oborn. He's the director of the Center for Medical Cannabis at the Department of Health here in Utah. We've been getting a lot of questions from our readers, from a lot of visitors to the pharmacies about our new program. And I thought this would be a great opportunity, Rich, for you to answer some of these questions. But to get into it, joking but not really joking, being the director for cannabis at the Department of Health, do you get looked at differently there? Are you the black sheep at the Department of Health?
Luckily, people that work for the Department of Health are pretty open-minded, and so I don't think I hope they don't see me that way.
Right.
But I started working at the Department of Health. It was just about 4 years ago when I started working here. And when I started at that time, I was the director of the Office of Vital Records and Statistics. And so I got to know a lot of people here at the department that way. We shared birth and death data internally with people in the department. And we had this sliver of a program that was under the Vital Records Office called the Hemp Extract Registration Program. And that was Utah's first little slice of medical cannabis operation under Utah state law being legal. It allowed for people with intractable epilepsy to have CBD, and they had to go out of state to go purchase it. The law was passed in 2014, and I joined the Department of Health in 2015. And so I got to know employees here at the department at that time, and I think employees here are open-minded about it, and so I don't think they see it as a black sheep. I think they've done their own research about it, and I think a lot of people in the public and in the industry have done their own research and have found that there's medicinal value. The federal government, of course, still has their position. It's against federal law, obviously. And under law, they don't find medicinal value, but I think we'll see that in the years to come. I think there'll be some movement as far as federal legislation will change. And with that, I think the public's perception and the public health perception of medical cannabis will change even more. But I feel like so much has changed just within the past few years, especially in Utah. And as more dispensaries in Utah open up, more medical cannabis pharmacies open up, it'll change even more, and people will build on, maybe they have just a little comfort with it, but I see in the future, we'll just build on that little comfort, and I think more and more people will see that there is some medicinal value.
Right, and you can see the paradigm shifting right now, and the voters out spoke in Proposition 2, so we can see the general opinion shifting. When the position for the cannabis director popped up at the Department of Health, did you hop on that opportunity?
It's a long story, but I'll try to keep it really short. I think I come from a background of public administration and political science. I went to the University of Utah and got my master's and the bachelor's there. And not long after I finished things up there, I started at the Department of Commerce, Division of Occupational and Professional Licensing. And after a few years there, I started overseeing licensing of pharmacies and pharmacists. And each year, there would be some cannabis legislation that came up. And because at the Department of Commerce, pharmacy is closely related to medical cannabis, I would do research on some of the legislation. I was just naturally, I think, interested in some of that. And I found it just fascinating that there were so many states back then, before we legalized it in Utah, that were legalizing it, although it was still federally illegal. I thought, gosh, this is certainly different. This is not the typical way legislation comes about. But I would just do a little bit of research back then, and I got also a sense when I worked at Doppel on what reasonable regulation looks like. It's not over-regulatory. We don't want to place burdens that are unnecessary on a private market. We want to protect the public and keep them safe. And there's limits to that. There are points, I think, when a government agency can be over-regulatory and I think abuse the power that they have. And I think we're in a regulatory climate in Utah where we feel strongly that there should be regulations, but they should be reasonable. And that we should, government agency does have a role to educate and not always penalize, but educate. And so I came from that background at the Department of Commerce and joined the Department of Health in 2015 with that background. And as I was Vital Records Director, we had this little hemp extract registration program I mentioned earlier that it was Utah's version of medical cannabis, although very limited, right? We weren't growing it in Utah at all at that time in 2014 and 2015, 2016. But each year there would be bills that would be filed by Mark Madsen and Gage Frower and others that would try to open it up just a little bit more beyond just CBD. And of course, that didn't happen. And then Prop 2 came up. There were signatures that were sufficient to get Prop 2 on the ballot, right? That was like in the summer of 2018. And at that time, I helped the department develop the fiscal impact statement that had to accompany Prop 2 so the public could know how much it would cost to implement it if it passed, right? And so I had to do some research about other states at that time. And the department kind of relied on me in some ways to help them with that and do some of the research. And that interested me. It was fascinating to learn about what other states were doing at the time. And then in October of 2018, the department began to see that writing was on the wall, Prop 2 was likely going to pass, and that there was some legislators that were working with people in the industry that were interested in coming to a compromise because the way the Utah law is written, the legislature can go in and amend a proposition that passes, right? And so they needed,
right?
yeah. So they needed someone to take the lead for the department on giving input to the legislature and implementing Prop 2 and the amended version of Prop 2. And they asked me to take that on temporarily, but over time it became a permanent role just because obviously Prop 2 passed and things moved forward. We hired a few more employees here at the department and I helped with that. And then I think it was about March 2019 when we formalized at the department and created the Center for Medical Cannabis, and I was hired as the director of the center. And so that gives you a little bit of background on how I came to work in this position.
Yeah, you definitely earned that role, it seems like. You had to get your feet wet before you were actually thrown into it. I really like the process that you had to take because, for one, we didn't know at a certain time if Prop 2 was going to be voted through or not. And
right.
So now that you're in this position, just, for a lot of people that are curious what the health department does with cannabis, what role does the Department of Health play in regulating the types and qualities of medical cannabis products that Utah pharmacies have?
Yeah, so right now what our role is to register patients. We have an electronic system that helps with that. We also register the providers that have completed certain education. And so that there's almost 400 registered providers in the state of Utah that are able to recommend medical cannabis to patients and help them get a medical cannabis card.
And that's growing tremendously, correct? Because even just back when we first started in March, what was there, less than 50?
Right, yeah. Just when we rolled out, it was a soft rollout because there were some things in the system we needed to work out, and that took some time.
Right.
With any electronic system that has a specific deadline that's set by a legislature, there's bound to be things that need to be filled in and gaps that need to be addressed. And so we've had a chance to do a lot of that since March. In fact, we rolled out some updates just the first week of July that provide more instructional text to patients as they apply and to providers as they go in and certify patients to receive medical cannabis cards. We oversee the pharmacies. We license the pharmacies as well. So there's patients, there's providers, and then there's, in Utah, what's called a medical cannabis pharmacy, but in other states, what's called a dispensary. And so we have 3 pharmacies that have opened so far. We oversee them. We make sure that the products that they're selling are compliant with the statute and the rule. And in large part, I think the industry and those 3 pharmacies have done a great job of understanding the law and understanding the limits of what they can sell. Obviously, they can't sell cookies and brownies and those type of edibles, but they can sell flour, as we've discussed. Initially, the initial law said it had to be in a blister pack, but that changed, and so no longer it has to be in a blister pack. And they can sell the concentrated oil, used in like a vape cartridge. They can use sell topical solutions, and those products go through testing before they're sold. The Department of Health doesn't oversee the testing component. That's done at the processing level, and the Utah Department of Agriculture and Food oversees that part of the program. But we coordinate closely with the Department of Agriculture and Food, and we expect that we'll continue to coordinate with them very closely. And so they're responsible for, like I said, the actual testing of the product, which is a very critical piece of making sure the product is safe for the public to consume.
Right, and that brings up one of my questions. Just through some of the interviews that we've done with the growers in the state and pharmacy operators, there's been a big gap between finished products and when the testing gets completed before they finally hit the product or the shelves, right? A lot of complaints from growers that they're having to hold on to product far too long. Is there any explanation for that, or do you anticipate that to speed up? I understand COVID could be playing a role in that right now as well.
That's true. Like I said, the Department of Health doesn't oversee the testing, but we do work closely with the Department of Agriculture and Food. Mm-hmm. And I know that as the program was rolled out, we were hopeful that the independent testing laboratories would be able to get set up quicker, but it turns out that it does take a lot of time. They have to invest in the equipment and to get set up appropriately. And so the Department of Agriculture and Food, what they realized quickly is that they as a department needed to take on some of the testing. Right. And that for the heavy metal testing, the Department of Health actually had to help with that. And so temporarily, that's what's happening right now, is that testing is done by the Department of Agriculture right now. And I believe that there was some issues related to COVID-19 with the number of employees that could work within a certain space, right? Closely with one another. Without COVID, they would have been able to process things a little bit quicker. But with COVID, it caused them to have to socially distance a little better. And so I think they weren't as efficient as they had been in the past. I think every state has growing pains. Right. They start Colorado and Arizona and Nevada were no different. They had certain challenges at the beginning. And so they had similar challenges that we're having. But it remains that one of the most important, I think, duties that the state agencies have is to do testing to ensure that the product is safe for the public to consume. And so we can't compromise on that need, right? Right. So, I know that there is a independent testing laboratory that I believe plans on opening later this summer. Okay. And there could be a second one later this year. And so I think as those surface, that testing won't be as much of a problem. But right now, yeah, it takes a little bit longer. I think the turnaround is about 2 weeks. between when a product gets to Department of Ag until it's actually able to be released and approved for public sale.
Right. And you hit on some key notes there. As we are a new program, we're evolving. You have new employees that are doing a new job, and no matter what kind of business you're in, there's going to be some holdup. But then also, you didn't expect to have as many patients as we do today. Can you tell me how many patients we had as of July 17th? Do you have that number handy?
Yeah, so we've got right now over, I think it's 6,500 patients in the program right now. And a number of patients have had the opportunity to renew their card already because they've had their card for over 90 days, and they've chosen to renew their card because they've felt that the product is making a difference. So despite I think, challenges with supply, many patients are finding that whatever product they purchased, it was working for them. They may find a better supply in the future, but it was working for them.
Right.
And so they're renewing their card, which is great. We that's what we want. We want people to be participating in the program. To be legally under state law is a big deal. People don't have to live in the shadows anymore in Utah.
That's
since
the
March.
biggest point for me, really.
Yeah.
I go to the pharmacies on a weekly basis, and some's work related, but I'm a patient as well. But the quality of flower that we have coming through these pharmacies, it's quite remarkable for a new program, and that's coming from somebody that's consumed for over 20 years.
Mm-hmm.
Given the surplus in patient numbers that we have, where do you anticipate these numbers to be by the end of the year?
I think we'll be at least 10,000. I think that's very conservative. We'll be beyond that.
Mm-hmm.
But initially in our projections, that's where we thought we'd be. So I'd say anywhere between 10,000 and 14,000 by the end of the year. And at that time, we wouldn't even be in the program a full year yet, because the program didn't roll out till March of 2020. So I think that's likely where we'll be. What I hope will happen is that those with just recommendation letters will convert and become a fully registered medical cannabis card carrying patient. Mm-hmm. They can go legally purchase right now from one pharmacy until the end of the year, with just a recommendation letter. But I would see that transition will increase our number of participating patients quite a bit, because I know there's a lot of people that fall into that category. What's important is that in some cases, I think those patients that have recommendation letters, they may not have met with a provider that's registered by the Department of Health. So it may require that they talk to their current provider a little bit more, see if that current provider is willing to register. If they are, great. Let's get them registered, that provider, and let's have that patient continue to meet with that provider, right? That's always the best case if a patient can continue to do that, because that provider obviously is already familiar with their background and their conditions and what other medications they're taking. And it's important for any provider that's recommending cannabis to be aware of all that. But it may require that the patient go and find a new provider, just because.
Visit in a sense, right? Where unfortunately you're just going to have to go somewhere else. And I have friends and people that contact Salt Lake City daily, asking where they should go next, unfortunately. And it's, a loss in dollars and a loss in time as well, which is unfortunate. But, that's why you need to do a little bit of research before you go, I suppose. And at Salt Lake City, we're trying to let, our readers know where the quality QMPs are in the state and which county. But I think you'll agree, especially through the statistics that you sent out a couple of weeks ago, with the amount of patients we have per county. When we have a new pharmacy open up, there's a huge surge in new cards, correct?
Right. Yep, and we'll see that happen more and more. I think we'll have one open up here in a few weeks in West Bountiful.
Right.
After that, we'll have another one that opens up in Provo, and we'll probably have some additional ones that open up in later this year in Lehigh and St. George, and more in Salt Lake City.
And that kind of leads into the next question. I know we don't have any set dates for these pharmacies to be opening. Bountiful is going to be within the next week or 2 weeks, from what I understand. We have 3 types of licenses in the state. We have growers, processors, and pharmacies, correct?
Mm-hmm.
And right now you can see the trickle effect of pharmacies opening up. They have a deadline till the end of the year, correct?
There's a soft deadline, and I say soft just because the law is written in a certain way to give some flexibility to that. We're thinking of tightening it up a little bit more to put a little more pressure on pharmacies to open up.
Okay.
But I think it's important that there be the supply of cannabis from the cultivators and processors that supports 14 pharmacies.
Mm-hmm.
And there are some cultivators who are far ahead than others.
Right.
There's 8 cultivators in Utah, right? And there are some that are far ahead. They're producing. They've really invested a lot of money in capital in building out and producing crop, right? And so they're far ahead than some others that are just really slowly moving forward. Some of those others have had issues, I think, with capital, and they've wanted to see how the market plays out a little bit, I think, before they invest more resources in growing and adding more space and more resources toward growing. Right. And so that's not surprising. I think every market that has opened up has seen some of that. One thing that Utah regulators and legislature, they were concerned about is an oversupply, and that some of that oversupply would go into the black market. Now, the cultivators, processors, and pharmacies that we have in Utah, they're responsible. They're a part of the team, and they don't want to divert product. They're not in it for that, and we vetted them to ensure that. But what we don't want is for them to have an oversupply, and so that was part of the concern. The way that the law was written, it made it so we were limited to a certain number of cultivators.
Right.
And so I think that come September, there'll be more supply. Come November, December, there'll be even more supply. And it takes time for these crops to come through, for things to be processed, for the cultivators to just perfect their growing schedule and the way they do things. And so I know it's frustrating a lot for some of the patients to go through some of the supply right now and to see how thin it is at times, right? But this is how it started in other states.
Yeah.
And unfortunately, it's some of that we're growing through some of the pains right now.
Right. And when we visited Zion cultivars a few weeks ago, they explained it to us pretty clearly. With 8 growers, we're going to be able to supply Utah patients no problem. And looking at states like Oregon that had a problem of surplus, and looking at other states to make sure we don't fall in the same category of mistakes, I suppose. What we didn't see coming was the amount of patients that we were going to have right off the bat. And I think you can probably agree to that. And that has caused the lack of products that we have in the 3 pharmacies that are open, which is a shame, and I think that's led into maybe high prices too. A lot of our readers have been contacting us, and how is the pricing for medical cannabis products determined, and do you think pricing is fair right now? Why or why not?
So the legislature was very careful not to control pricing. They leave it to the private market to set their own prices, right? So that's how we enforce it. There's $3 of every transaction that's taken that helps support the Utah Department of Health program, and that helps support the electronic system, and it helps cover the costs of regulation and things. and it helps protect the public. But other than that, there's no other thing that we require from the pharmacies or the processors or cultivators as far as price goes. So, like I said at the beginning of every program in the United States, when they've started this cannabis project in their own state, the price has been high. But then they get going after a few years, it gets lower. Then after a few years, it gets lower. I mean, California's been doing this since the 90s.
Yep.
One thing that's, I think some people disagree with this, but I think is healthy, is that Utah, there's only this $3 transaction fee, and that's it. You see in other states.
If you guys were getting $3 for me since high school, you could probably run this program for the first 3 years alone, and that was the first thing I thought about when I walked out of the pharmacy is, if we've been doing this a long time, the states would probably be in a lot better position. So it might be something we need to look towards in the future, maybe. Well, I guess we're already looking at that now, but bringing in revenue, and which is saying the word revenue. Can you share with us how much Utah patients have spent on medical cannabis since this program started, or is there an estimation?
That's something that we'll be releasing in August. I think what we're doing right now is collecting that data. We can release that information in August, and so I'd love to share it with you when we're able to have that all organized. We've got a reporting system that's being perfected right now that I think we'll be able to produce some of those general numbers in August that we'll be able to share with confidence.
And speaking of August, any word on the home delivery program rolling out anytime soon? Are you guys still working on that?
We are. It's a priority because we know it certainly makes the cannabis more accessible to patients, especially those in rural areas and just patients throughout the state that, are bedridden and aren't able to actually go and drive around all the time or are immunocompromised, and especially in a COVID-19 situation, don't feel comfortable going out in public to a pharmacy. So what I anticipate is that I see that rolling out in early fall. I'd say September. Right now, we're negotiating with our vendor about how to set that system up. There's some critical pieces of it for the industry that we're trying to put in place. We're trying to minimize the cost to the industry for connecting with the electronic system in order to do home delivery. And so those negotiations are ongoing right now, and we'll be, I think, finalizing those later this week.
And when this does start, who's going to be delivering cannabis in Utah? Will it be the Department of Health, the Department of Agriculture? Will it be private groups?
It'll be private groups. The Department of Health and Ag will never be delivering it to patients. It'll be a Dragonfly. They will contract with their own agent. That agent could be an employee of Dragonfly, or it could actually be it could be an agent of Dragonfly, or it could be a third-party courier that they hire to do it. That courier has to be licensed by our office if that's what they choose to do. They could also, like I said, just have their own employee do it. So a pharmacy agent, the agent that you see meeting with patients today in the pharmacy, they could send that patient to go do a delivery, or they could make it so they do half day working in the pharmacy and half day actually doing deliveries in Salt Lake, something like that.
It's great seeing these new jobs pop up, and you probably get, a lot of these thrown in front of you, or the new jobs that are popping up here in the state, which is exciting. We'll be posting a lot of these jobs on our website once they start becoming available. Grow jobs, pharmacy jobs. And some people probably wonder, would you yourself recommend medical cannabis to family members to use medical cannabis? Are you a patient by any chance?
I myself, I'm not a patient. I've been lucky enough with my health to not have a need to rely on medications in the past too much. Just, I'm recovering from surgery of some type. I've had my own little share of injuries, but most of those were when I was younger doing sports. But now I haven't had a need for it. But what I would say is that I know there's a lot of people that are struggling to find what helps them deal with the symptoms of their chronic pain, or that helps them control their seizures with epilepsy, or they're going through cancer and they're trying to manage some of the pain that comes with that. And so I know that by studies and just anecdotal stories that it has made a major difference for those patients. They've been able to, in cases of chronic pain, decrease the opiates that they're on. They either decrease it or throw them out entirely because of the medical cannabis that they've been able to find. I know in some cases it takes them time to find the right product that works for them.
Right.
And so I believe that over time they've been able to have confidence in that product and use that product and find that it helps them sleep better. I've found that just based on studies that I've read, that it helps them manage their symptoms. Their quality of life is better. What's unfortunate is that, of course, medical insurance doesn't cover the cost of it yet because of the federal law and how it's written. And so that's a frustration, I think, across the board is the cost, because medical insurance doesn't help. It helps with opiates, but it doesn't help with cannabis, right?
Crazy, right?
So I encourage people to learn how they can make it work for them. If it's something they want to explore, I encourage them to meet up with a provider that's registered on our website. We have a list of the providers that are registered by the Department of Health. And I think it's a conversation that more and more patients are having with their primary care providers. Because of, especially in Utah now that it's just brand new, more patients are having those conversations. We receive 10 or 11 across the state, 10 or 11 new providers register with the program that are coming up. And so more providers are noticing, there is some medicinal benefit here for my patients. I want to do no harm to my patients, but I do have a level of confidence in cannabis and being able to help them stop using opiates, right? And so they want to see that they're not strictly saying you got to stick with these drugs. They want to be able to expand and give the option to patients. Now, some patients take it and they find that it doesn't work for them.
Yeah.
So to my friends and colleagues out there, I would say, if you struggle with these conditions that are qualifying conditions under the Utah law, especially chronic pain, that's the most common one. I think 80% of people that are getting cards, it's chronic pain that's their qualifying condition, and it's very common, chronic pain, right? Even with, we've seen people, even in minors, they have chronic pain at times. So you have to be really careful with minors, right? But I feel like, hey, as long as it's over the supervision, it's under the supervision of a physician or an APRN or a physician assistant. Start low and go slow. See if CBD works at the beginning, maybe, depending on the condition. And if you need some THC in there, try minimal amounts of THC. Find the dosage type that works for you, whether it's vaping or a cream or a tincture. And let's get you well. Right. Let's have you experiment and see if this is something that helps you. If it does, great. Continue it under the supervision of a physician. If it doesn't help, let's find some other options that may be better for you.
Yeah, and we here at Salt Lake City, we don't claim cannabis a cure-all by any means, and a lot of people, especially here in the state, have never tried THC, cannabis in general. And what I appreciate about the pharmacies, and I can hear the eye rolls and the complaints of experienced consumers when they come into these places that are used to Colorado and California. But when they're complaining, they don't realize that a big chunk of our population needs this guidance. when entering this new green horizon, if you want to call it that. Since we don't do these interviews live on Facebook or anything, I went through the green scene the past few days and talked to some of our audience and gathered a few questions. A question that I got from Vanessa Tall, who works at Dragonfly Wellness. I'm just going to call her a bud tender. It's so hard for me to switch that up. But she wants to find out where people here in the state can contact their state representatives if they have problems with the program. Who should they be reaching out to?
Right. So any resident of Utah, they can go on to le.utah.gov, le.utah.gov, and there they can, there's tools on that website, the legislature's website, so they can find who their state senator is, who their state representative is, and they can contact them. Many of them, I think all of them have I know that all of them have an email address and a mobile number that they can reach out to them using. Now, I can't speak for the legislators. I know that some are better at responding quickly than others are, but I know that they are, right now, especially with the COVID-19 pandemic, they're preoccupied with everything COVID-19, right? And so I think especially now there could be a time frame issue of response, but that's where they would go to contact legislators if they feel like there's something that needs to be changed in the law.
And I feel, as a citizen, that's where change starts. And, a newspaper guy, we always joke around, write a letter to the editor, and get your voice heard. But sometimes that's where it starts. Another question from Dragonfly is, what is going to be done come end of year with the program as it's currently written as far as lettered patients go? I know we touched base on this, but is there any chance that there might be an extension? Anything in the windfall of what might happen to these people?
Yeah, so an extension of the letter time frame would require that there be a bill that is passed by the legislature. And the next legislative session, that's a general session, is not until January of 2021. There's some special sessions, but those are dedicated to COVID-19 mostly, right? And so I would be very surprised if something like that came on the agenda for one of those special sessions.
The agendas are thick right now. I know that.
Right. So as far as recommendation letter patients, what I would encourage those patients to do is to learn about how they can become a medical cannabis card holder. We have resources on our website. There are user guides. It goes step by step, literally step by step, screen by screen, what someone will see as they go through the process. I understand that not everyone is excited about having to go through a user guide. And that there are a lot of systems out there that don't require user guides, that they're more intuitive. I think our system is becoming more and more intuitive. It has more instructional text. It's more user-friendly than it was when it rolled out in March. And so I know there are some patients that had a bad experience with the system when they tried to apply in March, or they heard about a friend that had a bad experience with it, so they just don't want to even try it. They're just wanting to rely on the letter. But the law is not going to change between now and the end of the year.
Right.
So I encourage those individuals that have recommendation letters to email us at medicalcannabis.utah.gov, to call us at 801-538-6504. And if we don't answer, we'll get back to them. We'll answer their voicemail. We'll call them back. We're just now getting back to some of those people that have left voicemails, and we're getting better at getting back to them quickly. So I think they'll find that they're able to do it, that it's not as hard as maybe they've heard that it is to get a medical cannabis card. There's only a $15 fee. They do need to meet with a medical provider that's registered by the Department of Health. Now, I do know that the pharmacies, at the 3 pharmacies, they are required when they sell a product to a recommendation letter patient, they're required to educate that patient or to give them information about getting a medical cannabis card. And so that's something that we need to follow up with the pharmacies about. I think in some cases, maybe there's some room for improvement on the education that the pharmacy does with the patient about the medical cannabis card. And maybe in some cases, a patient forgets where to go. It's medicalcannabis.utah.gov. That's where they go to get a medical cannabis card. So I can understand why there's some reluctance on some patients to apply for a card. But what I'm hopeful about is that we can work with the industry on educating patients about how easy it can be, and also that we can just walk them through it if they need help. There's a lot of elderly patients, and as we know, the older population, sometimes they struggle more with doing things online. And so I'm hopeful that people like that will be able to rely on a trusted son or daughter or a trusted friend that can help them do it and walk them through it. And if they have trouble as they do it, that they contact us. But I'm confident that the electronic system that we have in place to register patients is strong, and that it's able to help people through right now. And there's user guides that can help people through. So I think the answer to the recommendation letter concerns, the best answer to that is, don't be afraid to learn more about how you can get a medical cannabis card. Do it now. Don't wait till November, December. Do it now. It's only $15. I know for some that's a lot of money. For others, it isn't. But I'm hoping that they can just take that jump and make it happen and reach out to our office if they need assistance.
Right. And I think just following through, you've already taken that one step of getting the letter in. I kind of explain it to my friends and people that ask. It's a lot like getting your driver's license. You have to go through the protocol that you'd normally go through with the DMV with getting your paperwork in order. But once you've done that, you're set. My 90-day re-enrollment, went down a few weeks ago, and that went through smoothly, and once you're in the system, things are good. Which reminds me of just one more short question. Hopefully you can answer this one shortly. Had a lot of questions from our audience about gun ownership when getting a medical card. And we've answered those questions, but now how can we ensure people or residents of Utah that their information is staying secure when they become a medical cannabis patient, that their information isn't going all over the place?
So there are some protections in the law that state how private the information in that system is legally required to be. For example, the electronic system, there is a window that law enforcement has to have in order to verify that someone is indeed a card holder, but the medical condition of the patient isn't disclosed to law enforcement ever on our end from the database. They can't see that at all. They're closed off from that part of the database. The only individuals that view the medical history or the treatment history or the actual condition of the patient is their provider. Also, staff here at the Department of Health, as we go through and approve applications, it's only viewable to those individuals that must, because of their state role, view that information at the Department of Health. So it's very limited who's able to view it. Now, a subpoena or a court order, there would be a requirement that we release that if there's a judge that requires that we release it. And we're not releasing any information that's identifiable as part of a public report that we're doing. We would never release it for those purposes. I think I can understand why people are reluctant to share it with a government agency, but it is, I think, something that we take very seriously. We have the protections, the security in place to ensure that that information doesn't go beyond the tight restrictions of the database.
Awesome. Well, it's good to know that, our patients are being taken care of. And it's also reassuring knowing we have people like you at the state that are in the good fight and trying to push this in the right direction. So I can't thank you enough for taking the time and answering. I know we left stuff out. We're going to hear it from our audience. There's just so much to talk about. And
Yeah.
these questions need the real answers. And so that's why it was great to talk to you, Rich. And
Great.
we'll have to have you again or on here again soon. And as this year goes on, we're going to have a lot of changes, a lot of new things opening. And, it's only been 3 months or 4 months now, and it's been a lot of fun. So thanks a lot, Rich, and keep up the great work. All right.
Great. Thank you. You as well, Cole. I'm excited to be a contributor to the industry as a regulator, and I feel that the industry so far has been a good player, has worked with us, and we've been able to get good input from the industry and from patients regarding ways that we can improve things on our end. And I'm excited about the way things are going, and I can see that there are some things that can still be tweaked to improve, and I think we'll be following that closely.
Yeah. And you guys are doing great. So again, keep up the great work, and we'll talk to you again here soon, Rich.
Great. Okay. Have a good one. Take care.
Yeah, I think we're all set, Rich. I appreciate you, my man.
Yeah. Thank you.
Sorry, it went a little bit longer. I knew we were. I just had so many questions there.
Yeah.
Personal question for me, and this isn't even in your department now, from what I gathered, terpene reports. Are we going to have anything on that anytime soon on the testing?
I've heard there's some interest from Department of Agriculture in that. You'd have to contact them directly. There's someone by the name of Cody James you could speak with.
Cody James.
Uh-huh.
That's what I was thinking. The next step, the next interview we have to do is with somebody at the Department of Agriculture and get their piece too. And
yeah.
Thanks for
I can share with you his
too at Standard or at the new pharmacy opening up. We have an interview lined up with them next week.
Oh, good.
Our audience, we've been getting questions all week. When is that new pharmacy opening? And I'm like, we don't know, but we'll let you know next week maybe.
One thing that I can make sure gets to you is that in August, we're planning on having a much more robust data set that's shared with the public and with you about medical cannabis sales, the number of transactions throughout the state, and the revenues that have come through. And so I think you'll be interested in sharing that with people that follow Salt Lake City.
Absolutely.
I'll make sure you get a copy of that. I think a story that some people don't pay attention to that's important also that you could take a look at is the Compassionate Use Board.
Yes.
They do a lot of work. They get a high volume of cases. These are cases of minors. Mm-hmm. Any minor that goes through, they have to be reviewed by the Compassionate Use Board. And they have done a good job of evaluating those closely. Also, any cases where the person they're an adult and they don't have a medical condition that is under the law allowed, but they feel like there's still a justification for approving it. Mm-hmm. If their physician supports it, the Compassionate Use Board reviews it, and then they make a recommendation to the department. And there's been about 60 or 70 cases of those that have been approved by the Department of Health already. Oh, wow. So some people get fixated on the, hey, it's only for these conditions, right?
Right.
It has not been approved for depression, anxiety, or sleep apnea yet in the law. Right. And so there's frustration about that to some degree, right?
Right.
But in the end, if they have a provider that's willing to recommend that they get a card anyway, our Compassionate Use Board has reviewed those petitions, and in some cases they've approved them.
Yeah.
And so it's not that if your medical condition is not specified in the law that all is lost. The Compassionate Use Board and the Department of Health have been very interested in learning more about the case and in most cases approving those to receive a card anyway.
Right.
So I think that's just something that I wish there were more focus on, because people get the misconception that it's only these people with these conditions that can get a card.
Well, and we were talking with a few of the employees at Perfect Earth in South Ogden, and they were telling me about, and just because of HIPAA, I can never get any names, but they told me about a juvenile that his mother was the caregiver, and kind of gave me the backstory on what was going on. And one thing we're trying to do at Salt Lake City, again, just being so shorthanded, we haven't been able to turn on the faucet completely yet when it comes to content. Patient profiles are really important to me, showcasing Utah medical cannabis patients. And we can get locked in with just thinking of the adults. I really want to focus on some of the kids that are, but the tough thing is finding people that want to be in the limelight, that want to put their story out there.
Utah Patients Coalition could help with that.
Yeah, Desiree and Mario, they've been a huge help. Shelly over there. Again, we've just been shorthanded. We started doing a patient profile one a week, and that's what we plan on doing. But with the start of the business alone, and just the problems you're going through, it's very. I can relate a lot, just in any startup, and with COVID going on, and just being a new cannabis magazine in Utah, it's almost like introducing cannabis to Utah for you.
Right.
We've gotten some backlash, but we've gotten a lot of praise too. So it's been a fun journey so far.
Good. Great.
But yeah, feel free to let us know any stories. You have Abraham's email now. He's my managing editor, and we work hand in hand. So if there's a story that's pressing on that you need to let people know about, let us know. We're your ally in this, and we get to have a lot of fun with the cannabis culture and the 420 culture. But what we're here to do is to educate Utah residents about medical cannabis and the benefits and the new science. And that's why we're talking to Olivia Bujum and the scientists involved that can really shed light on what we're really doing in the state. It's not a bunch of, toking stoners coming out of the garage, if you want to put it that way.
Right. Yep.
But anyways, well, I'll let you get on with your Friday. Enjoy your weekend. Thanks for taking the time with me today, Rich.
You too.